Welcome to the Ovation Healthcare Learning Institute podcast, your source for informative and inspiring conversations around the world of healthcare. Hear from the individuals and organizations making a positive impact on the industry and bettering the health and economic wellness of their communities. In each episode, we bring together thought leaders, healthcare professionals, and industry experts to discuss the latest trends, technologies, and best practices. Whether you're a provider, a patient, or simply interested in the ever-evolving world of healthcare, this podcast offers valuable insights across the entire care continuum. Subscribe today and be a part of the Ovation Healthcare journey.
I'm so happy to be talking about this topic this year. And really, I'm going to be focusing on what can we think through to make us a better board, a better senior leadership team in 2025. I think this is key for a lot of different reasons. There are so many changes coming down the pike. There's a lot of stuff happening. Some of the boards I talk to are scared for some reason or another. Lots of things happening. There's change going to happen. And guess what? It's always been that way in healthcare. Change is coming. All we can do is be as ready as humanly possible. So some of what I'm going to talk about this morning is really just preparing ourselves in a lot of different ways. Last year, I talked a little bit about succession planning, and oh my goodness, it has come up in every hospital that I get a chance to work with. Succession planning, succession planning. Even if you're not even expecting a retirement in the next year, you've got to be talking about this. So what is the board's role in succession planning versus what is a senior leader's role in succession planning? So we're going to be talking about some of that. Also, better preparation for yourself. Anybody done their board self-assessment in the last few months? Thank you for raising your hand. This is very important for us to understand what group of people are we working with and where do we have to continue getting better every day to meet the objectives coming down the pike. Okay, not just from the state, but from the national perspective. We're going to talk a little bit about knowing your why and building resilience as well. So this morning, we've talked about a lot. We've talked about every topic that's important in your manual, right? You have your manual with you. This baby has been around for a long time. I started working with Quorum back in 2004, and this book existed. Except there was a difference at that time. This book used to talk about compliance, and it talked very little about quality, which was my world back then, right? So once I finally got my hand on this manual, we started adding the quality elements, and no more important time, because back in 2004, it seemed like everybody knew their quality director was that, one nurse who sat in her office and looked through medical records, right? So a lot has changed since then, and our language around quality has changed. So quality is a discussion this afternoon, along with experience of care as well. Our life is changing in this role. So pay attention to that quality of care issue this afternoon. Our language is changing around this. 10 years ago, I was talking about population health, right? And then we started talking about social determinants of health. Oh, by the way, now it's called social drivers of health, and we're measuring it slightly differently. And oh, by the way, strategic planning, you have to have a strategic portion aligned with social drivers of health as well. Changes continue to happen. So as a board, this is not said to frighten you, but it's just meant to be mindful of what's coming down the pike and understanding that as the language changes, our mentality is also meant to change around healthcare, okay? So even this afternoon, when we talk about patient experience of care, we're going to be talking about what does that mean to us when we go from a typical domain of quiet at night into 2026 when we start looking at how restful was my stay at the hospital. Whoa, that is a mindset change, is it not? Quiet at night, how loud is it in the hospital versus am I getting rest at night in the hospital? And how are we facilitating that? Ooh, it's a tough one. So a lot happening there. So as we hit these, every single domain, it's yes, obviously in your book, and you can look back and you can continue to teach the board members that are not here, but in particular, pay attention to these slight shifts and changes every year. It's why I suggest to the boards that I get to work with and that I get to support that they come to this every year, or at least get the monthly education on webinars, okay? Because that is just as good. It'll keep you up to date. It'll keep you on the cusp of what's happening today and right now. How many of you have been on the board for more than 10 years? Yeah, so there's a lot of you. And then some of you are brand new. Okay, so there's no knowledge gap here. History is history, but you do need to know where we've come from to continue on moving forward, okay? So there's a lot to discuss, and there's a lot to keep up with and continue to working through. Some of the other important things that were brought up this morning, I'm going to bring us back to Philip. Philip, thank you for a very engaging compliance discussion this morning. It is hard to make compliance engaging, but it's something that we need to know. It's something that we need to look forward to. For those of you who didn't know, of course, the compliance officer reports to the board and to the CEO, and there are reasons for that, right? It helps us to reduce bias in any way, but also allows that free flow of conversation to happen with the compliance officer when they feel as though they need to speak to the board. That's okay. He gave you 7 essential guidelines to meet a good compliance program. Keep those. It's one of those things you should laminate and put under your pillow, okay? Herb got up here and was talking about finance and some really important pieces. Herb and I have these discussions all the time about when do you have a finance committee or not. And it's sometimes discussions that I've had with the hospitals I support. Should we be having a finance committee? How many of you right now are working on RevCycle in your hospitals? You looking at RevCycle? I bet you are. You may not know that, but your operators are looking at RevCycle from the beginning to the end, and every single spot in between. So as we're talking about finance committee and the who's and what's of every single month, and digging in and asking the questions around your KPIs, it's important to know, is there money coming in the door? What are the payers paying us, and what is the yield on our payer contracts, right? So all important topics, all mentioned by Herb this morning, along with a scorecard in your material that is incredibly helpful. So if you're not using that finance scorecard already, it's very simple. Use something like that, okay? All talking about strategy. So usually Ginny and I are somewhere near the end of the day kind of doing a wrap-up conversation, but this is beautiful timing as well. Strategy is key to how are we going to get there. And the execution of that, last year we spent our entire time up here talking about execution of your strategy, and are you doing it or not, or is it sitting on a shelf, right? So some of the things that we're going to talk about in these next few minutes are going to facilitate some of those strategic initiatives, and how do we as a board get there. If there's anything I can bring out to you and say, hey, these are really important. Chip talked about this slide this morning, and he focused on that upper quadrant that says Board of Trustees and Directors and talked about your role, your role. Please understand that the role of the hospital administrators, the medical staff, and care teams, not just medical staff, and community are also very important, and they also need to stay in their role. Does that make sense? The more we creep out of this role, the more a board gets into operations, it becomes a little bit more challenging, right? Continue in 2025 to allow your operators, allow your senior leadership team and their teams to operate and run your hospital with your vision of strategy, okay? That might seem so simple, and yet oftentimes we're up there saying, board members, nose in, fingers out, right? Ask questions. In here, in every section, there are questions for everything that you should and can and will ask, right? Dig in, ask questions, but then step out and let your operators do the work, right? I'm getting some nods. Thank you for that. Okay. So another one to laminate and put under your pillow. You're thinking, Erica, what do you have laminated and put under your pillow at home? Maybe it's this. I don't know. Come on, thank you. All right, so this becomes important. For those of your board members that aren't here, please take this latest edition with you if you didn't last year. Chip mentioned that we're going towards the 10th edition at some point, and again, we'll continue to make this more robust with what boards need to know today. You think that, boy, Erica, is it really going to change that much? We have additions every time we redo this, right? Because healthcare is changing. How many of you are on other boards in your community? Mm-hmm. Yeah, so I just worked with, I think it was February 14th, last Friday. I was with the New England Collaborative Health Network, and I got to talk to them a little bit about succession planning and board self-assessments and that sort of thing. And we were going around the room, and I was so impressed because every single person in that room was a board member or a senior leader, and they said, and I'm on this many other boards. And a woman got up and she says, I'm on 9 other boards. And I thought to myself, wow. Anybody on 9 other boards? But I thought to myself, wow, they're stretched. But something else she brought up was being a part of a board of a hospital is totally different than being a part of a board elsewhere, right? I mean, sure, there's Robert's rules and those things, they might be the same, but what we have to understand as board members, as volunteer board members, is a lot, right? So basic education every year becomes mandatory, so hopefully this can help you in the future, but it's also gonna help you in this next thing we're gonna talk about, in its transitions, right? This is a biggie. Anybody experience any senior leadership transitions in your hospital in the last 12 months? Yeah. Okay, so in the hospitals that I work with in the last 2 years, I've had turnover of 4 CEOs, 2 of them retired, and 3 CFOs, 2 of them retired. That's a lot, right? And yet, you can prepare for years for retirement and still at the end say, woo, maybe we weren't ready for that change, right? Any transition is key right now. Any transition is key right now, meaning it will impact your structure. And I love that Deborah Bowen brought this up. She says it's not just good succession planning, but succession planning will help you create a leadership development type of a program in your hospital, in your health system. And that is needed today more than ever. It's very interesting to me how different this can look at every hospital, and yet what I'm seeing is people don't understand that this is not just about senior leadership turnover and succession planning. It's not just about management succession planning. We need to talk about board succession planning too. Some of you haven't had board turnover in a long time, but I can tell you in the last 2 years, the hospitals that I've worked with have had 1 with none, and the rest 50% turnover. Whoa! That kind of turnover, especially in a strategic planning year, you're playing catch up. And if you don't have great things in place, like a super great and educated board, like a senior leadership group, that can continue those transitions and help each other, it's gonna hurt, okay? Culture change always happens when turnover happens. Did you know the statistics on CEO turnovers? 2020, 2021, 2022, we were at about 16% nationwide for healthcare turnover. In 2023, we skyrocketed. For a lot of different reasons, but we did. And in 2024, we kind of came back down. We're going to be looking at more of a 17, 18% type of healthcare turnover for CEOs. But what does that mean? It means there's a lot of shakeup, right? There's a lot of transition, whether it be healthy transition or planned transition or not. We've got to be ready for something like that. I work with hospitals that say, well, our CEO is not going to turn over for another 10, 15 years. I'm like, okay, all right, right? You still have to succession plan anyways. You still have to do that anyways. Did you know that when CEOs turn over, that other senior leaders in the organization tend to turn over at the same time or shortly afterwards? It's a high probability, okay? So the more you can do to prepare for those transitions, the better. And part of this is board oversight, right? First, the board needs to look at your own succession planning for your own selves at the board level. And some of you are telling me, Erica, we're voted in, we have no control over who we get. And yet you as a board can say, boy, we're about to lose a really good finance person and a really good contractor off the board. Can we fill those spaces with other community members and put out the need? Okay? We can have those conversations to say, hey, we need some people with this kind of background to continue to contribute to the board. Okay? There are better ways of doing this that perhaps we haven't done before. At the New England Collaborative I was at last week, I was talking with a group, Cottage Hospital in Vermont, and they brought on 2 new board members, but what they saw in their original marketing to the community was they had a picture of what a board might look like, and the picture of the board itself was a turnoff to the community because many of the members of the community weren't identifying with the board members in that picture. I don't know what your community looks like, but if you're looking for people that are from a different generation than you might need to think about that, right? You might need to think about that. Generational differences can actually be quite powerful in engaging the rest of your community. So something to think about. But for us, as the board, thinking about how do we succession plan for ourselves better than we have before, using appropriate onboarding, and how do we work with our senior leaders, the CEO, in this transition as well, because it's incredibly important that you're working closely together, that you're being mindful of each other, and that you are a team. Something that we brought up last year, and we work closely with Whit Kiefer, who specialize in recruiting. Some of the rural areas that we work with are harder to recruit to than others. However, in every case of the 4 CEO turnovers that I've had, I've received 50 to 100 resumes for those positions. Guess how many were actually qualified? Okay, it's a lot. It's a lot to look through when only a small margin are qualified to be at your hospital. Okay? Where we get hung up in these steps when we're thinking and being thoughtful about succession planning for the CEO is we get hung up on step number 3, assess your current bench. I'm not asking you as a board member to assess your current bench, but I'm asking your senior leadership to assess their current bench and say, is anyone probably going to be ready to step up as an interim even in a CEO position? And then your senior leadership team needs to say, can anyone, if stepping up into a CEO interim position, can anyone step into an interim CFO position? Can anyone step into a CNO interim position? If the answer is no, you are not succession planning well. Okay? So as you are succession planning for a CEO, know that you need to think about the rest of the house as well. You as a board, your job is to hire that CEO, engage with that CEO, okay? That CEO's job is to make sure that the rest of the house is taken care of. So they need to make sure that the succession plan exists at every other level. What I'm finding is number 3 is a weakness. We may have a bench, we might have a powerful bench at our hospital, or we might have none at all, okay? So this needs to be looked at, this needs to be assessed when you're thinking about the steps of succession planning and what might be a future pitfall for you, is do we have anyone who can step into this position right now, in the next 6 months, in the next 2 years, in the next 5 years, okay? If your answer is no, we have some work to do. okay? Now that's just for internal candidates. Oftentimes we have to look externally, right, at candidates as well. Even when I've done the best succession planning we can possibly do in a hospital, and we think we've got the candidate who's gonna come in after our CEO is retired and everything's gonna be fine, don't you know something happens, right? And then we still have to look externally anyways. It's a good habit to think of, I've got to look externally anyway. Look at those best candidates externally, hold them up against your internal candidate, and it might be 95% of the time that your internal candidate wins the day. But it's always good for that board to look elsewhere as well if you feel you need to, okay? So succession planning is multiple tiered. It's very important. I'm going to tell you something that everybody up here is going to tell you as the board. Monitor this. Right? If you have a great succession plan in place for your CEO and other senior leaders, you will actually have a policy on it that comes to the board for you to approve, in which your CEO is reviewing the succession plan with the other senior leaders every year. And that policy will also say this is a succession plan for senior leaders, and oh, by the way, we are always doing middle manager training. Do you have any new middle managers in your hospital right now? Raise your hand. Most of the time, middle managers come from the front lines to become managers, right? And in that pivot, they rarely get leadership development training. So you just took perhaps a bedside nurse and put them into a director position saying, good luck to you, right? So yearly middle manager training is important. So think thoroughly about your succession plan, board members, not only for yourself as a board and for your senior leaders as a board. You're accountable for that CEO, but for the senior leaders in this group to think about the rest of the organization as well. So lots of us think through this in different ways. Succession planning is key. I want you to think about that. But let's talk now about knowing yourself. What are these key habits a board can have that are so good? I asked you, how many of you who have done a self-assessment lately? There's a lot of guidance around this. In fact, if you're some way aligned with Ovation Healthcare, we use operating practices with you every year, and there are 52 operating practices, and we love them dearly, and we update them all the time. So know that your senior leaders have these operating practices, and in this operating practice are your board self-evaluations. Know that when we give guidance, we say, yearly basis is probably good. Yeah? Some of you stretch them out a little longer, especially if you haven't had any turnover on your board. But my guidance to you is, even if you haven't had any turnover on your board, do these anyway on a yearly basis. Learn where you are in your key areas, and I'll show you an example here in a second. Make sure you're getting all of your board members engaged, which means 100% of your board should be engaged with this. And that means, even for some of you who don't like to do this electronically on the link that we give you, we can print out a paper copy and let's do it that way. 100% on this, okay? 100% engagement means that everyone's had their view of how are we doing right now and where do we need to go, okay? I'm going to show you something on how to track your progress. We do this for you and with you, but it's important to do so because year over year, it's important to say, how are we? Where are we? Even when I've worked with hospitals for years and I see variation in those scores, my question is why, right? Variation tends to exist, especially with finance, the understanding of finance. And when we aren't doing well, especially as we've pulled out of COVID, or if we're doing huge rev cycle projects of some sort, that financial number usually goes down, right? It's not that we don't have enough information at times. Sometimes it's just that I'm feeling a little uncomfortable, right? So we can talk about that and how to look at that as well. So those board self-evaluations are necessary. Is anyone doing this last bullet? The chair evaluation. I'm looking over there because I know I've got one over there. Most of you are like, I'm volunteered chair, so no, we're not doing a board chair evaluation. I get where you're coming from. But I'm going to pinpoint Chad Esty over there. Chad, if you'll raise your hand. He does yearly board chair evals, which I respect. And I think what we're finding is, Chad, no one else wants to be board chair. So, there's that. I'm saying consider this. For some of you who are thinking, what can we do better? What can I do better? As board chair, this is a viable way to do so. So let's talk about best case scenarios. As you know, since many of you have taken a board self-eval lately, you should be looking at each of these categories. Bam, they're all in here. Cheat sheet, okay? We talked a little bit about the changes in every area, and this afternoon we're going to talk about more. So it's important that you know yourself, are we still as good as we can be? With things changing all around us, are we as a board still as good as we can be? Here's Gonzalez. My Gonzalez family right here, right? I put this up here because I'm extremely impressed with Gonzalez, not because of what Jenny said in the strategy area, but because they are introspective and at this moment saying again, how can we continue to do better? So this is what they did with the results this year. You can't see it, but I'm going to explain it to you. They took every question under every domain, and here I have the planning domain and the quality oversight domain, and they looked at it year over year. Their board has not changed in a long time, but I think as we discussed, you're going to see some perhaps turnover here in the future. But their request was, okay, if we're the same board, why are our numbers fluctuating? Where are we feeling that we're extremely strong today versus before, and where are we feeling a little bit of vulnerability where we can get a little bit better? Taking these results and assigning them essentially to one board member and one senior leader to say, how are we going to improve this for next year? And aligning that with the strategic plan that they just did, perfection, okay? As an operator, that's what I want to see all day long. So this is good stuff. Gonzalez, if you could raise your hands right there. Go meet this board, everybody. Okay. A part of becoming the best board you can be is not only saying, what can I do better, but how can I continue doing better? Part of that is education. We're going to have David and Sam come up in just a little bit, and we're going to talk about board certification. I want to end with know your why. Know your why. This afternoon, Gina's going to talk a little bit about experience of care, but she's going to talk about resilience. The employees at this hospital's resilience, the employee at this health system's resilience. How are we doing? How are you doing individually? Remember, if you got on a plane the other day, they told you to put your own mask on first before helping others. There is a reason for that. Today, more than ever, this resilience is powerful. We've got to have it, and yet, if you're on 9 other boards, you might feel a little weak sometimes, right? So monitor yourself, and then know your board members around you at the table. How are they doing? Right now, could they possibly take on one more thing or no? Can they possibly give as much as they need to give? Can you continue to give as much as you give? Ask yourself the questions. Resilience will become a factor today if it hasn't already, okay? But I want you to know your why. Here's my personal story of the last 12 months. As many of you know, as I've talked about before, my daughter has both liver and heart issues. In my last 12 months, with her have been 3 hospitalizations, 2 liver infections, 1 blood infection, and then her constant monitoring of her heart, which you see right there. And then I have a son who's, my daughter's 15. I have a son who's 16 who breaks his finger during baseball season at football practice, right? Can't make this stuff up, right? Yeah. You've had it happen, right? So know your own why. Why are you a part of this? I've had board members say, Erica, I'm a penny pincher. That's why I'm on this board. Okay. That's great. We need you. I'm going to remind you what I remind everyone else. Let's find that balance between finance and operations. I love your penny pinching. I love it, love it, love it. Now let's balance. Okay? So everyone's why is a little bit different. I encourage you, board members, please find your why. Find it today, find it tomorrow, find it on Thursday during these excellent presentations, and bring yourself back to your why. Why are you doing this for the health system? Why are you doing this for your community? It is volunteer. And yet you are needed and you are valued, and every decision that you make and every part of that vision that you move forward every day is important. Here are my key takeaways. Thank you so much for being here. I think we're okay. Okay. All right.